Hello, and welcome to the Goodwill Industries of Southern New Jersey and Philadelphia's COVID-19 Risk Management Preparedness and Response Plan. Goodwill Industries cares about and supports its employees and clients during this confusing time. This information session will give employees helpful information for returning to work. We are extremely excited and thankful to have you back working with us. That being said, we want to keep you as safe as possible. Before we jump into the rest of the presentation, let's take a minute to refresh our minds about Goodwill's mission. Our mission is to provide education, training, and employment services that prepare individuals with disabilities and disadvantages for competitive employment in the community. Everyone in the organization, from retail staff to mission staff to corporate staff, has a huge part in helping put people to work. Now let's get into the rest of the presentation. The purpose of our Risk Management Preparedness and Response Plan is to prepare Goodwill Industries of Southern New Jersey and Philadelphia for the threat posed by a potential crisis event and develop a plan of action and response procedures. The response thresholds and actions planned in these procedures will be taken to mitigate and respond to any threat based upon information that becomes available prior to and during the spread of the COVID-19 virus. The objective during reconstitution is to effectively manage, control, and with safety in mind, expedite the return to normal operations. Goodwill Industries will continue to protect its team members, shoppers, and donors with the guidelines below that are in accordance with federal, state, local regulations and best practices. Goodwill Industries will continue to monitor hour by hour state and local government requirements. Goodwill Industries' mission to provide education, training, and employment services that prepare individuals with disabilities and disadvantages for competitive employment in the community continues to be the focus of our organization. Now that you've returned to work, what you can expect from us. Procedures and work areas designed to limit close contact with coworkers, customers, and donors. Cleaning supplies to clean break rooms, offices, cashier stations, computer keyboards, restrooms, etc. Soap, warm water, and paper towels in restrooms and break rooms. Use hand sanitizers when unable to wash hands. Social distancing in break rooms. Outdoor space to take breaks when possible. What we expect from you. Wash your hands often. We ask you to wash your hands when you get to work, before you leave work, before and after lunch breaks, after using the restroom, etc. Cough and sneeze into your elbow or into a tissue. Tell your supervisor immediately if you feel ill or have a fever. Stay home if you are sick, including a fever and cough. Keep break room and common areas clutter-free and clean. Don't keep extra items in the fridge or in the break room. Wipe down your eating area when finished. 6 feet distance from coworkers, customers, and donors. Provide excellent customer service while maintaining social distancing. And discuss concerns with your supervisor. What is Goodwill of Southern New Jersey and Philadelphia doing to stop the spread? Goodwill has put several new policies in place to protect employees, customers, donors, and the community. The measures that the Goodwill Industries of Southern New Jersey and Philadelphia is taking to stop the spread of communicable diseases such as COVID-19 are the following. Goodwill Industries of Southern New Jersey and Philadelphia has modified its policy to mandate customers to wear personal protective equipment as a preventative action to protect our employees and other customers. Goodwill Industries has provided all stores with occupancy numbers to support social distancing guidelines. A designated employee is to count the number of customers to support occupancy standards. Currently, Goodwill is using the standard of 1 shopper per 144 square feet of sales space. Goodwill Industries has closed all fitting rooms and restrooms to limit exposure. Goodwill Industries of Southern New Jersey and Philadelphia may monitor an employee's health status as they present for their scheduled work hours using confidential health assessments. Goodwill Industries has also implemented an employee health declaration protocol that employees must use to assess their health status before reporting to their work location for every shift. Goodwill Industries has updated and implemented a stringent policy addressing communicable diseases in the workplace. Goodwill Industries is using social distancing and awareness. Floor markers that support social distancing guidelines in cash wrap lines. Directional arrows and applicable aisles marked with social distancing guidelines at regular intervals. Floor markers to explain on the overhead audio as well as on signage displayed throughout the stores. In-store communication via print, audible announcements, and employee interaction. Goodwill Industries is using social distancing and awareness. Floor markers that support social distancing guidelines in cash wrap lines. Directional arrows and applicable aisles marked with social distancing guidelines at regular intervals. Floor markers to explain on the overhead audio as well as on signage displayed throughout the stores. In-store communication via print, audible announcements, and employee interaction. This slide gives you an example of social distancing. Please be sure to stay at least 6 feet apart from coworkers and customers at all times. Now we also want to talk about cleaning procedures. Return shopping carts are isolated and moved to an identified area where a trained designated employee sanitizes them and places them in a staging area. A designated employee will continuously wipe down entrance and exit door handles throughout the day if applicable. Cashiers are spraying, wiping down credit card machines after each customer and replacing press and seal covering as needed. Employees are using disinfectant to clean donations and work areas while processing. All retail and donor locations are utilizing 2-hour recurring cleaning schedules, including all material handling equipment. Rolling material handling equipment that leaves the production area is sprayed and wiped down and allowed to air dry. This includes all carts and Z-racks used to move donations. When talking about cleaning procedures, we also need to talk about hand washing. We encourage employees to wash their hands frequently following the below steps. 1. Wet your hands thoroughly. 2. Apply enough soap to start a lather. 3. Lather and scrub for at least 20 seconds. 4. Rinse your hands for at least 10 seconds. 5. Use a towel to turn off the water tap. And 6. Dry your hands thoroughly. Also, don't forget to wash in between your fingers, under your nails, and the tops of your hands. This slide shows you the correct way to wash your hands. Communicable disease, COVID-19, return to work onboarding checklist. All employees will complete an acknowledgement of the additional training and safety expectations the first day back on the job. Employees are expected to wear all required PPE, including when interacting with other employees, customers, and donors. This includes break rooms, community rooms, and all other areas of the facility. These protocols will be enforced. As an employee, you serve as a representative of Goodwill organization in our community. You must act accordingly to all applicable social distancing guidelines required by the CDC and local law enforcement. Now you may be asking yourself, as an employee, what is expected of me? As mentioned in previous slides, you will be expected to complete the following health declaration protocol before reporting to your work location for any scheduled shifts. These are the questions that you will be answering. Have you experienced any difficult breathing, shortness of breath, loss of smell or taste, or symptoms of acute respiratory illness in the last 72 hours? Yes or no? Have you experienced a fever, 104.4 or greater, within the last 72 hours? Yes or no? Have you experienced signs of a fever such as chills, aches and pains, etc., within the last 72 hours? Yes or no? Have you traveled within the past 14 days to an affected area as identified by the CDC? A current list of countries is maintained at the CDC website. Yes or no? Have you had contact within 14 days with a lab-confirmed COVID-19 patient? Or having direct contact with infectious secretions? Yes or no? If you answered yes to any of the 5 questions above, kindly contact the COVID-19 hotline at 439-0200, extension 99019, and your direct manager. If you answered no to all 5 questions, then you may report to work. When applying masks, bandanas, or gloves, wash hands with soap and water for at least 20 seconds. Apply face mask or bandana. For face mask, place mask over your nose and mouth so it fits just under the chin. Secure ties behind your head or elastic over your ears. Ensure the mask fits snugly to your face and under your chin. When putting on gloves, select the correct size and ensure there are no rips or tears in either glove. Make sure gloves are pulled on tightly so that each finger is securely in the finger sleeve. On this slide, you can see the wrong and the correct way to wear your mask. No matter what type of mask you are wearing, it needs to be covering your nose and mouth at all times. To remove masks, clean your hands with soap and water or hand sanitizer before touching the mask. Avoid touching the front of the mask. The front of the mask is contaminated. Only touch the ear loops, ties, or bands. Follow the instructions below for the type of mask you are using. Face mask with ear loops. Hold both of the ear loops and gently lift and remove the mask. Face mask with ties. Untie the bottom bow first, then untie the top bow and pull the mask away from you as the ties are loosened. Face mask with bands. Lift the bottom strap over your head first, then pull the top strap over your head. Throw the mask in the trash. Clean your hands with soap and water or hand sanitizer. This slide shows you the wrong and correct way to remove your mask. Never touch the front of the mask with your bare hands. Always remove the mask by the ties or the fastening mechanism. To remove PPE gloves, pinch and hold the outside of the glove near the wrist, but not touching the wrist. Peel downwards and away from the wrist, turning the gloves inside out. Pull the glove away to completely take it off and hold it in the hand you took it off with. Slide fingers of the ungloved hand into the other glove in gaps under the wrist without touching the outer surface. Peel downwards and away from the wrist, turning the glove inside out. Pull the glove away to completely take it off. Hold the inner surface of the glove as a pocket with the other glove inside the pocket. Dispose of the gloves in a rubbish bin with a lid. Immediately wash your hands with soap or sanitize with hand sanitizers or alcohol. This slide shows you the correct step-by-step process to remove your gloves. Notice that your bare hand should never touch the outside affected part of the glove. If you are wearing goggles due to PPE requirements, to remove the goggles, wash or sanitize your hands before removing your eyewear. Once eyewear is removed, sanitize them with sanitizer or disinfectant. What should I do if I or someone I live with has tested positive for COVID-19? All employees are required to communicate immediately to their direct supervisor and/or HR if a member of their household has tested positive for COVID-19, and stay at home if they have any COVID-19 related symptoms, specifically shortness of breath, cough, or fever. We will require maintaining the respect and anonymity of employees through this. Employees are able to reach out to Human Resources via the COVID-19 support line at 1-856-439-0200, extension 99019. As an organization, we will not disclose the medical status of any of our employees with the rest of the workforce. Leadership will work closely with Human Resources to determine the appropriate next steps and what communication is required to take place. The employee must have a doctor's note clearing them to return to work before they can come back to the location. What should I do if I have COVID-19 symptoms or I feel sick? An employee may request time off in writing for up to 2 weeks. The employee must also create the request in the employee's Paycom portal. Employees must use available paid time off. If the employee does not have any paid time off available, it will be unpaid. Any concerned employee should also visit the CDC's website for more information on what to do if you are sick. What should I do if I have been near someone who's tested positive for COVID-19? Employees may request time off in writing for up to 2 weeks. The employee must also create the request in the employee's Paycom portal. Employees must use available paid time off. If the employee does not have any paid time off available, it will be unpaid. Now that you are ready to return to work, employees will be asked to complete a checklist in their Paycom portal before they begin their first work shift. This checklist will ask various health assessment questions, as well as any updated personal information, such as telephone number and direct deposit and address. Now is the time to update any information that may have changed while you were away from the workplace. Now, as you know, every employee needs to clock in through the kiosk when they start their shift. Going forward, every time an employee clocks in for their scheduled work shifts, they will need to add in a pre-developed comment noting that they are free from any COVID-19 symptoms. If an employee does not add this comment, they will not be able to clock in. Training for employees on this task will be given by their location management team. This presentation has given you a lot of information for your return to work at Goodwill Industries. We are excited and thankful to have you back as a part of our team. As always, the safety and health of our employees is the top priority for Goodwill Industries. Please feel free to discuss any concerns or questions with your direct supervisor. Please stay safe and stay healthy.